So right now we're going to move on to the drugs that work on the autonomic nervous system, getting a really broad overview. And with that broad overview, we're going to start out with a simple 4-part rule. And if you remember the rule and logically apply what's going to happen in each instance, you're going to be really well on your way to fully understanding the drugs that work on the autonomic nervous system. At this time, we're going to start playing with that 4-part rule, but when you stop the podcast, if you can keep thinking about it, that's going to really help reinforce your understanding of the autonomic nervous system pharmacology. Our rule is on this slide. Drugs that affect the autonomic nervous system are going to have one of 4 actions. They can increase the sympathetic nervous system, increase the parasympathetic nervous system, decrease the sympathetic nervous system, and decrease the parasympathetic nervous system. So let's take each one of those scenarios. What would happen, for instance, to the heart rate, the contractility of the heart, the diameter of most of the blood vessels in the case of an increase in the sympathetic nervous system? And yes, if the drug was increasing the sympathetic nervous system response, the increase in heart rate, increase in contractility, and the contraction of the blood vessels would all occur, and that type of drug would greatly increase the blood pressure. And like I said before, in order to understand the other actions of that drug, all you have to do is understand the fight or flight response and then go through those other organs that are innervated by the sympathetic nervous system. Another action of drugs that affect the autonomic nervous system is that it could increase the parasympathetic nervous system response. And for that, let's take the example of a different organ. Let's say the gastrointestinal tract. What would happen if a drug increased the parasympathetic nervous system response? How would it affect the gastrointestinal tract? Well, it would increase the digestion. So there'd be more activity, more secretions into the GIT. The person may get diarrhea. Their food would be metabolized much more quickly. Another thing that a drug that affects the autonomic nervous system can do is to decrease the sympathetic nervous system response. Let's say that someone was administered that drug that decreased the sympathetic nervous system. What would that do to the lungs? Well, that would constrict the airways of the lungs. And as you can imagine, we're not going to want to give that type of drug to a person to decrease airways. It would actually be a side effect of a drug aimed at doing something else. That type of drug that decreases the airways is going to be contraindicated in somebody, for instance, with asthma. And finally, the other thing that the drugs of the autonomic nervous system can do is to decrease the parasympathetic nervous system response. And to help give us a picture of those types of drugs, let's just take another organ. What would happen with a parasympathetic nervous system antagonist, so something that blocks the rest and digest system to the pupils of the eyes? That would allow the sympathetic nervous system to dominate, and therefore there'd be a dilation of the pupils of the eyes, and along with that, there may be a little bit of eye pain that's associated because we may be allowing too much light into the eye, and that's oftentimes painful. So the best idea is to quiz yourself on this rule. Go through each one of the organs and each one of the scenarios and try to predict what would be happening if a drug increases the sympathetic nervous system, decreases the sympathetic nervous system, increases the parasympathetic nervous system, or decreases the parasympathetic nervous system. With that, you'll really understand and remember what drugs of the autonomic nervous system can do. But unfortunately, like you'll hear me say a number of times throughout this unit, there's always exceptions to the rule in medicine. never say never and never say always. So if you ever see a multiple choice question in pharmacology that has one of the answers as always or never in it, it's normally something you can just cross off of your list of possibilities. There is an alpha 2 receptor in the sympathetic nervous system that's a receptor that's basically employed to make sure that the sympathetic nervous system doesn't get out of control. Imagine that you're being chased by something. And what prevents you from getting so much adrenaline that your heart starts going so quickly that you end up with a heart attack? If we didn't have the negative feedback portion of the alpha 2 receptor, then that would be a possibility. So as we evolved, we realized that the fight or flight response was so potent that we needed to have some part of that response as a negative feedback, and the alpha 2 receptor is that. So whatever hits the alpha 2 receptor, it's going to pretty much do exactly opposite of what our rule is talking about. We're just going to put the alpha 2 receptor aside. That's going to make things really easy. We're going to talk about the alpha 2 receptor much later in this unit. And for right now, we're just going to concentrate on everything but the alpha 2. And the other exception to the rule is that there's nicotinic receptors in the parasympathetic nervous system. Recall that we had a 2-neuron pathway, and the acetylcholine is the main neurotransmitter of the parasympathetic nervous system. Well, the first neuron in the parasympathetic nervous system has some nicotinic receptors, which we're going to put to the side as well. And simply by putting those two exceptions to the rule aside for right now, we're going to understand about 95% of the drugs that work on the autonomic nervous system and have those really good firmly in our mind without any confusion.